when most people see that lovely little face, they tend to think, "Ah, isn't that cute?" But for me, as a vet, when one of these little dogs came into the consulting room, I would get that heart sink feeling, because I would know that I was going to have some difficult conversations with that owner. Just a little bit about me first. I qualified as a vet in Edinburgh in 1978, had 2 years in very mixed practice in County Durham, virtually next door to the James Herriot practice, and was dealing with a lot of farm animals, beef cattle and sheep up on the moors, and race horses, greyhounds, racing pigeons, that sort of thing that you get in the northeast of England. But in 1980, I went to Pdsa in Dundee, the People's Dispensary for Sick Animals, and I went there intending to stay for a month. And I loved the work so much that I stayed for the next 40 years until I retired last year. For those of you who don't know what Pdsa does, it is a charity providing free and low-cost vet care for sick and injured pets of people in need. And it also promotes responsible pet ownership. And it does that through largely a series of pet hospitals spread across the country, over 40 in the UK. And the work is very much that of a normal private practice. So you'd be consulting and they'd be providing medical and surgical treatments. In non-COVID times, we also provided preventive treatments at affordable prices for flea and worms, neutering, microchipping, that sort of thing. And in later years, education became very important to us, and we introduced some appointments that I'll talk about later on, where we could spend more time with clients talking about animal welfare. So I retired last year, and now I like to spend a lot of my time outside. Again, in non-COVID times, I like to get up in the hills, but more recently it's been mostly birding and photographing the wildlife around my home here in northeast Fife. Now, I don't claim to have any specialist knowledge of brachycephalic animals, but I do have 40 years experience of dealing with them in a very busy practice situation. So that's the perspective I'll be coming from in this very personal look at flat-faced dogs and the problem, and cats and rabbits, and the problems that they face. So I'll be talking about what brachycephalism is when I can say it. I'll be talking about which breeds are affected and look at whether it's a new problem or not. And then in some detail, I'm going to go through the problems that do affect the flat-faced breeds, because it's more than just the breeding problems that most people are aware of. I'll have a quick look at how we can treat some of the conditions that affected pets get, and also probably discuss the scale of the problem, how big a problem it is. And then finally, in the last section, I want to look at what everyone can do to try and address the problem. So what is it? Brachycephalism, a long word. Vets love long words. Basically means short and head. And if you look at the various definitions out there, you'll see that most of them have broad and short in the definition. So we're talking here about animals with a much shortened nose. And if you look at a normal dog, that's my dog, sadly no longer with us, the nose area is markedly long. And then if you look at a brachycephalic animal, you can see how flattened that facial area is. And it's actually flattened at the back as well, but that's maybe less obvious. In recent years, by far the commonest breeds that we were seeing in Dundee were French Bulldogs, Pugs, and the Bulldog breeds. But as you can see from the list, there's quite a few others, and even more than I've put on the list there that might be considered to be brachycephalic. And it's not just dogs. We get brachycephalic cats increasingly now as well. Some of them with very, very short faces. Persians, Burmese, and Himalayans are the main ones, but we saw some with pretty short hairs with very short noses as well. And rabbits, again, if you look at the wild rabbit at the top, you can see it's got a nice triangular nose, whereas these at the bottom, very flat, very shortened noses. And Netherland dwarfs and the lionheads are becoming particularly popular as well. So is it a new problem? Well, this handsome fella on the left is my great-grandfather, Robert Cage, in about 1875. And I don't think that strange beast on the stool beside him was his. I think that's probably a photographer's prop. But if you look at it, you can see that it's got a pretty flattened face and the bulging eyes that are very typical of a brachycephalic dog. And when you think about it, it's taken tens of thousands of years for evolution to produce a dog that's adapted to doing the things that dogs should be able to do, like breathe properly. And only a few centuries of man breeding for specific features and appearance to create animals like this. And we can argue about whether the shape is changing over time. I think in some ways it probably is, but certainly looking back to 1875, you can see it's been a problem for well over a century. And in the 1920s, nobody could say that these had a nice shaped face. Everybody knows, as I've said, about the breathing problems that these dogs can get. But if you look down the list, there's lots of other parts of the body that can be affected by this condition in these breeds. They have many other problems, and we'll go through them one at a time and talk a little bit about them. And all of those problems can affect their life expectancy as well. And the fundamental problem, of course, is the skull shape. And here we have on the left, German Shepherd, with a long jaw area and mouth and face, and a long drawn out brain cavity at the back. And on the right hand side, we've got a pug, and you can see all the soft tissues of the face would have to be squashed up into that tiny little space. And the back of the head is also squashed, so it's much shorter across there for the brain to fit into. Now, looking at the breathing problems first, when you breathe through the nose, first place the air goes is in the nostrils. And again, if you look at my dog here, she had a lovely pair of wide nostrils there, plenty of room for the air to get in. And then if you look at the little fella on the right, you can see that the nostril is almost completely occluded by this flap of tissue there. And diagrammatically, you can see that if you've got a wide nostril and a tube that's straight going into the back of the throat, the air can flow in very easily. But if you've got a tiny nostril and an airway that's so squashed up that it's all twisted and all the bones get in the way as the air goes in, that airflow is seriously blocked. This image is taken from the Pdsa's Pet Health Hub, which is a very useful online place to look for information about all types of issues affecting pet health. And if you imagine pinching your nose and then trying to breathe, it's actually quite difficult, and you can't do it as well as talking at the same time. But if you can't breathe through your nose, you have to try and breathe through your mouth. And these dogs have problems with that because they have obstruction in the form of the tongue. And that tongue isn't actually too big, it's the face that's too short, so it's squashed up into the mouth. And at the back of the mouth, the soft palate, the flap of tissue that hangs down, is often enlarged as well and doesn't fit in the back of the mouth properly. And in my experience, the tonsils in these dogs are often enlarged as well, and that can form yet another obstruction. And again, diagrammatically, in a normal dog with a normal long nose, the soft palate, is small enough to stay clear of the airway. Tonsils are small and hidden in little sacs at the side, and the tongue fits nicely on the floor of the mouth. But in a brachycephalic dog, the palate hangs down so that it's often touching or occluding, blocking the airway. The tonsils can press in from the side, and the base of the tongue can be so squashed up that there's almost no airway there at all. And a little bit lower down, we have a voice box and a windpipe. In a normal dog, at the entrance to the voice box, there are a couple of sacs that bulge out from the airway. And because brachycephalics breathe so hard, those little sacs get sucked into the airway, which forms another obstruction. In addition, many of them are born with a windpipe that's much narrower than normal. And a couple of things that are often overlooked, I think, if you've got a dog that's breathing really heavily and puffing and panting all the time, that causes inflammation in those airways. And that inflammation can lead to thickening of the lining, and it can lead to production of excess mucus and blood. And all that can add to the problem. So the airflow can be seriously restricted. And again, diagrammatically, in a normal dog on the left, wide windpipe, sacules the right place, you get a good airflow. And in a brachycephalic on the right, you can get serious obstruction of the airway. So not only are you trying to breathe through your nose that's blocked, but you're also trying to breathe as if you were breathing through a straw. And all of those respiratory problems, all of those breathing problems, we tend to put together into this syndrome that we call the Brachycephalic Obstructive Airway Syndrome, or BOAS. And what effects do all these things have? Well, the first thing is noise. You'll probably all have heard a pug walk past going. Now, vets can identify several different types of noise depending on where the worst of the obstruction is. But it's fairly irrelevant, because all it is means that the dog is struggling to breathe. And they'll have to breathe quite rapidly to get air in, and maybe an excessive panting. They'll often end up lacking oxygen, so the tongue may be blue. And all of that can lead to exercise intolerance, so they're not capable of going on long walks or exercising properly, and collapse. And I strongly suspect that a lot of these dogs suffer from sleep apnea. And we know in humans that sleep apnea can, over a period of time, cause extreme fatigue. They're also very, very prone to heat stroke. And every summer we'd get these dogs coming in a pretty much collapsed state, making desperate attempts to breathe, terrible noises, and they would require emergency treatment to save them in many cases. And again, because of all the inflammation in the airways, pneumonia can be very common in the breed as well. But dogs aren't stupid, and they'll often try and find ways of making life easier for themselves. So they may sit with their upper jaw propped up on something, so the lower jaw can hang open and open the airways a little bit. We'll often see them sleeping with a toy in the mouth to actually try and hold the airway open. And on a number of occasions, I've seen dogs recovering from an anesthetic do this and actually hook the upper teeth onto the bars of the kennel to try and hang the lower mouth, the lower jaw open, so that the airway is open and they can breathe more easily. But it's not cute to be unable to breathe. If we look at other problems in the mouth, there can be problems with the teeth, problems with the jaw alignment, as you can imagine, if the whole face is squashed up, and problems with tongue injury, and all of those can lead to eating difficulties. We look at the teeth. This is the nice, smooth, even layout of a dog's teeth with a normal facial appearance, and on the right, a brachycephalic, which has got what my wife would refer to as sugarly teeth, which are all over the place, one pointing that way, this one pointing that way. They don't meet properly. They probably meet on the actual jaw rather than on the teeth, so they can cause injury to the other jaw and pain. And the jaw malalignments very probably can cause arthritis in the jaw over a period of time as well. Rabbits are prone to tooth problems at the best of times, but brachycephalic rabbits are even more prone to getting problems. And although it often appears that it's just the front teeth, the incisors, that can be affected, you'll often find it affecting all of the teeth and causing pain and discomfort and difficulty eating. Just look at the length of the tongue on the left there. But of course, it's not actually a long tongue. It's a jaw, a mandible and maxilla that's too short. And look, these dogs only need minor injuries, like a slight road accident, a knock, something like that. And like the dog on the right, they can end up with actually over a third of the tongue having to be removed. So easy to bite the tongue if it's sticking out of your mouth the whole time. So it's not cute to have problems eating or mouth pain. Moving on to the eyes. Again, on the left, eyes of a dog should be on either side of the bridge of the nose, small enough that the eyelids can close over it. But on the right, get the classic bulging eyes that ends up with so many problems. Can be minor problems like squint that probably don't bother the dog much. Much more seriously, they can be unable to blink properly, and that can lead to drying of the surface of the eye, the cornea. And if it's bad enough, that drying can lead to ulcers, which are extremely painful and can be very difficult to treat. There's another condition called cherry eye, which is more common in brachycephalic breeds. I'll show you some pictures of that later. And many of them can get eyelid problems as well. So if you're squeamish, just don't look at the next slide. On the left, we have a little dog. Sorry, I'll see if we can go back there. We have a little dog, and there is just a small ulcer starting to form on that eye there. But on the dog on the right, we have a very deep ulcer that's penetrated the eyeball and that's actually bleeding. And these can be very difficult to treat. And corneal ulcers are 19 times more common in the pug than in crossbreeds. And all too often, ulcers that keep recurring can lead to the loss of one or both eyes. And we did have several dogs that we had to remove both eyes from because of the ulcers. This is cherry eye. You can see this little gland, which should be on the inside of the third eyelid, the pink bit that flicks up like a windscreen wiper across the eye, distributes the tear film. That can turn itself inside out, not just in brachycephalics, but it's certainly commoner in them. We were seeing an awful lot in French bulldogs before I retired. And it's maybe not as painful as some of the other conditions, but it can be certainly uncomfortable for the dog. Other problems with basically hairs, and this is one of the folds of skin that shouldn't be there on the nose. It's there because the nose is all squashed up, and you can see quite clearly that's rubbing on the eye. You can also sometimes get extra hairs on the eyelids themselves that will grow inwards instead of outwards. And you can get all sorts of misshapen deformities of the eyelids in some of the breeds. The problems with the eyelids can cause a lot of rubbing as well, so you can end up with irritation, ulceration around the nose and the eyes. Little dog on the lower right has just had some dye put in the eyes, some fluorescein. We use that to stain these ulcers so that they show up at an early stage. You can pick them up, because you really do need to catch them early if you're going to be effective in treating them. And it's not cute to have sore eyes. Looking at problems in the skeleton, many of these animals will have abnormal development of the vertebrae. So they may be missing vertebrae, or have half-sized vertebrae, or twisted vertebrae. And we saw all of those in Pdsa, and can result in curvatures of the spine. There's a condition called screw tail, where the tail is twisted so tightly at the top of at the base that it can cause problems. And there's a high incidence of slip discs as well in some of the breeds. And these abnormal developments cause pressure on the spinal cord. They can cause pain, either directly because of the pressure or because of the twisting of the spine that you can get. They can lead to weakness, paralysis, and incontinence, both fecal and urinary incontinence. And again, very, very difficult to treat these. And I don't like to see dogs in carts, but that's a personal opinion. And a number of animals do end up, the only way they can get about is with a cart. And it's certainly not cute to be unable to stand or walk. Brachiocephalics get multiple gut problems. The commonest two, probably, certainly that we saw, were regurgitation is very common. And that can be both normally, sometimes they can sick up a bit of food immediately after eating. But much more importantly, if they do that when they're under an anaesthetic or recovering from an anaesthetic, the fluids from the stomach can be inhaled into the lungs, and that can cause a condition called aspiration pneumonia, which can be very difficult to treat as well. So there's a big increased anaesthetic risk with that. And something that we underestimate in dogs, but I'm sure they get, is nausea. And I am convinced that some of these dogs went around feeling nauseous a lot of the time. Very difficult to prove that. But it's not cute to feel sick and risk choking. So we've seen this picture before, problems with the brain. The short skull causes an increase in brain pressure. You can imagine the brain of the dog, comparative size, plenty of space in there. If you look at this one, it's shortened at the front, shortened at the back, and that means that the brain is basically squished. You can end up with a condition that I'm not even going to try and pronounce. We'll call it CMSM, which can lead to fits and pain. And if we look at this scan, back of the brain in this section is quite normal. But in this brachycephalic, it's been squished to the point that the brain is actually missing a section here. And it's certainly not cute to have head pain and take fits. Still on the skeleton, they can get problems with the development of bone and cartilage in the legs as well, which ends up with abnormal joint angles, bandy legs, legs going in all directions. And that in turn can cause the kneecaps to dislocate. And in many dogs, it will lead to arthritis long term, simply because the joints are getting abnormal wear and tear over a long period of time. And that can lead to lameness, further reluctance to exercise, more pain. Can also end up with them getting fat, and since many of them have fat to start with, that can be a vicious cycle that ends up with them even more reluctant to exercise, even more lame and even more pained. And it's certainly not cute to be unable to walk without pain. Just look at the folds on that face. Facial folds can cause horrific skin infections. At the bottom of each of those folds, when you open it up, it's often bright red, sticky, smelly, infected, and basically horrible. And the same can happen at the back end, where you get the screw tail and the folds are so tight together that you can get nasty infections in the skin around the tail as well. And to cap it all, many of these dogs are prone to allergic skin disease as well, which just adds to the problem. So it's not cute to have itchy, inflamed skin. Because the dogs are having to forcibly breathe and have low oxygen levels, that can lead to extra strain on certain parts of the heart, which can cause secondary cardiac disease. And that can lead to more fatigue, more breathlessness, more exercise intolerance, and of course, either a lifetime of medication or in some cases, death, I'm afraid. So it's not cute to suffer from heart disease. Breathing problems. Normal dogs have a somewhat triangular head that's designed to come through the birth canal in a relatively easy manner. But if you've got a large head relative to your body, as many of these have, and if you've got a flattened head, that can make it very difficult to engage with the birth canal. And whelping problems may be 16 times more common in French bulldogs than in crossbreeds. And all of this means that there's an increased need for caesarean sections with all the attendant risks that that entails. And in some breeds, it's reported that up to 80% of them need caesarean sections in order to give birth. 80%. And there's a good paper that I've put at the bottom there by Evans and Adams that goes into that in more detail. But it's not cute to have to struggle to give birth. And all of those physical problems that I've mentioned can lead to a reduction in life expectancy. In a non-brachycephalic dog, you'd expect 12 3/4 years now, probably. Brachycephalics, only 8.5. That's 4 years, more than 4 years difference, 32%. It's a big difference. And again, another great paper that I've listed at the bottom there by Packer and others is well worth a read. So it's not cute to live a short life, blighted from birth by man-made defects. We'll have a quick look at how vets treat affected individuals. You can't make a silk purse out of a pig's ear, so whatever you're doing with these, you're never going to end up with a perfect dog. What you're trying to do is minimize the suffering and give a good quality of life. But it's a shocking fact that up to 1/5 of all flat-faced dogs require some sort of corrective surgery in order to get that quality of life. And because each dog may have multiple problems, where do you start? We'll have a look at a few of the things we can do. This is something we can do. We can improve the flow of air through the nose by cutting out this flap of tissue here and a fold that goes up into the nostril. And we'd started to do that almost routinely in these dogs before I retired. It does make a difference in some of them, but often it's not enough. So you've got to go in, you've got to shorten the overgrown soft palate, cut that away. I always removed the enlarged tonsils anything to give them a little bit of extra airway. You can go down into the voice box and remove these saccules that have turned themselves inside out. With the eye, you can remove or replace the cherry eye. And you can remove skin folds to prevent eye damage and skin infection and inflammation. Corneal ulcers are a tricky one. You attempt to encourage healing in the early stages. If it gets worse, you may need grafts. We were using contact lenses to try and protect the eye. But sometimes we had to remove the eyes themselves. And we did all of the above things in Pdsa on a regular basis. But some of the dogs with spinal problems could get surgery, often wasn't appropriate, but they would have to go to specialists for that, with all the attendant costs that that entails. And with any of these operations, there's a big risk of with surgery itself. The dogs are starting off, they've got a compromised airway, they've got multiple health problems, they've got low oxygen, they've got an increased risk of heart failure. They're often prone to slow recovery, and they might regurgitate. Vets nightmare dealing with these. And afterwards, because all the tissues that you're cutting out in the back of the throat and the nose got a lot of blood vessels, they can bleed a lot, so you can get problems with hemorrhage. And whenever you do surgery, you end up with inflammation, and that can swell and again cause more post-op obstruction. And of course, you've got the pain of surgery to deal with as well. You can do some non-surgical things. Oxygen, really important, particularly in the emergency cases that come in collapsed. You've got various medications, anti-inflammatory drugs like steroids or non-inflammatory, non-steroidal anti-inflammatories, painkillers, treatment for the eyes, treatment for the skin, treatment for the heart, treatment for the nausea. Weight control, absolutely vital. Many of these dogs are overweight, and weight control absolutely essential for many of them. And you need sensible exercise regimes. They're not capable sometimes of doing a lot until you've got the weight under control, but sensible exercise regimes does give them a good better quality of life. And sadly, sometimes we just can't help to give them the quality of life that they deserve. And some of these dogs do end up euthanized far too young. So how bad a problem is it? How many brackies are there altogether? Well, according to the Pdsa's poll report last year, there's just over 10 million dogs in the UK. And according to another report by O'Neill and others of dogs they looked at attending vets, nearly a fifth were brackies. So that gives us a figure of around 1.9 million dogs alone. That doesn't count the cats and the rabbits. But what proportion of those have problems? That's quite difficult to say. With some conditions, we know the relative frequency of that condition compared to crossbreeds, but how many of the dogs have one or more problems? I can only go anecdotally on what I've seen in practice, and I would estimate that between 50 and 80% of them have problems. So that's an absolute minimum of 1 million suffering dogs out there. 1 million suffering dogs. And what's changed since I started in Pdsa in 1980? Well, when I did start, we were probably seeing 1 or 2 pugs and peaks every month. And by the time I left, we were seeing several French bulldogs, pugs, bulldogs every day. A big increase. And Battersea Dogs Home has recorded an increase in the amount of surgery that they're doing from 7 in 2015 to 62 in 2018. And the Kennel Club itself figures so show that French Bulldogs increased by a staggering 2,747% in 13 years. So for me, it's not whether the condition is getting worse so much. It's the fact that the increase in popularity and appeal means there are far more of these dogs, and that there is an overwhelming increase in the amount of animal suffering as a result of that popularity and appeal. And again, in the poor report last year, Pdsa, vets were asked to name their most important welfare issues that need to be addressed for dogs. And for the first time, exaggerated conformation shape in pedigree breeds was at the top of the list, equal with obesity. That's how serious it is. So what can we do? We've got to do something. I can't get over that dog on the left there. That shocks me every time I see that picture. It really does. So vets, what can vets do? Well, vets have a dilemma, because they have the dog coming into the consulting room and they may desperately want to say, why the hell did you get one of these? Well, we can't do that. We have to do the best we can for that dog to give it the best possible quality of life. But we know that that's going to take time. There's going to be difficult conversations with the owner about the problems they may not even be aware of the dog having, and certainly what might develop over time. We know that the owners of Brachiocephalics are very strongly attached to individual pets and often to a particular breed, so that if one of them dies, they will go out and get another French Bulldog. And recent research shows that many owners are in denial. 58% of owners whose dogs have had a vet say that their dog has a breathing problem, say their dog does not have a breathing problem. And they normalize it, and this happened a lot. You'd have the dog going, and you'd point it out to them and say, doesn't that worry you? And they'd say, no, that's normal for the breed. It might be normal for that breed, but it's not normal, it's not right, and it's causing suffering. Other problem vets have, it's quite difficult to encourage owners to get pre-purchase advice. We often are presented with the animal after they've got it. How do we get them to seek our advice before they actually go out and buy one of these animals? And these difficult conversations take time, and that always is going to involve the cost of the veterinary time. However, there are positives that we can do. Client education, really important, as I said, preferably pre-purchase. And a lot of that can be done at vaccination appointments. Pdsa developed in recent years Petwise appointments, which were much longer appointments where a client could speak about animal welfare needs with a nurse, a qualified veterinary nurse or a veterinary care assistant, and they were very popular. Vets often have open days, and when we had an open day, we'd often have a display with brachycephalic information on it and talk around that to anyone who was interested. And a lot of practices have websites and can educate people through those. Vets need to address obesity. We know pugs are 3 times more likely to be obese than crossbreeds. There are some very good grading schemes now to assess the severity of BOAS and the other conditions. And it's important to use these so that we can both inform the owner. It's a useful tool to see whether a condition is getting worse or better and how effective surgery has been. But it's also a way of gathering information and building the evidence base that we need to tackle the problem. Vets can write articles for the local press, they can go on TV and radio phone-ins, that sort of thing. And they can support, publicize and take part in research. And I've just named 2, there's plenty of researchers working on brachycephalics, but the Brachiocephalic Working Group and the BOAS Research Group are doing sterling work in trying to build this evidence base. that we need. And vets can support and share their organisations and charities' policy statements and encourage individual practices to include policy statements on their websites as well. One thing any vet who's concerned about the problem can do is sign up to Vets Against Brachycephalism, a really useful website, a lot of resources on there, including these wonderful comparison pictures of normal and brachycephalic animals. The last time I looked, there were over 1,000 vets, over 250 nurses and technicians from nearly 60 countries signed up to strive for better animal welfare for brachycephalic animals. And these are some of the policy statements that have already been made. We've got the British Veterinary Association policy statement, and they have a Breed to Breathe campaign. Pdsa's policy statement on brachycephalic animals, and some very good local practice or private practice statements as well. And vets can write to their journals to keep other vets, keep brachycephalism in the mind of all vets at all times. What can breeders do? I'm not going to mince my words here. The single most important, best thing to do to start to tackle the problem would be to stop breeding brachycephalics and stop breeding them now. But I'm not naive enough to think that's going to happen. So I would encourage breeders to crossbreed, breed with longer-nosed dogs, to only breed from the very best of their dogs, to breed for health, not looks. And breeders can tackle the Kennel Club and address issues with the breed standards. Kennel Club's done a lot of work. They've made huge progress. They've put a lot of money into some of these research schemes, but there's still a lot needs to be done. And if you look on the right, one of the breed standards, the pug, should not be lean or leggy. Well, that's just an encouragement to have a fat dog. The head should be relatively large, the muzzle relatively short, blunt and square. No, 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 the muzzle and the head should be normal for a dog. And the mouth should be basically deformed. No, no, no. And it's really important for the Kennel Club to enforce breed standards more strictly, particularly registration and in the show judging ring. And what can we all do? We need an increased awareness of the problems. We need to educate ourselves so we know as much as possible and educate everybody else. Use social media. Social media is great to share information across a wide range of people. Support all the charities and organizations that are dealing with brachycephalism by donating or volunteering. Contact your MPs and MSPs. I went to see an MP, an MSP about a pothole problem, and within 5 minutes I was talking to them about brachycephalism. You can do it. Organizations such as A-Law, a group of lawyers very concerned about animal welfare, are working towards law changes. And in the Netherlands, the breeding of extreme short-muzzled dogs was banned since 2014, and registration now requires vet approval. It's early days to see how that's working, but it's obviously encouraging. And we can encourage public education, getting animal welfare, especially pet welfare, on the school curricula. And if you see criminal activity, such as suspected illegal importation, because many of these dogs come from illegal breeding abroad, report it to trading standards. And if you see obvious cruelty, SSPCA as well. Lucy's Law, which means that people are supposedly only going to be able to get dogs from registered breeders, or rescue societies may go some way towards helping. This is something everyone can do. If you see brachycephalics being used, as they are increasingly in advertising, marketing, promotion, or by celebrities, call it out. Some examples here where I've called it out on social media. The one on the bottom left was embarrassingly at a veterinary conference. They apologized very quickly and withdrew that. Got Glasgow City Council setting up pug cafes. Great news. We've got Fife Libraries here who put a picture of a cropped ear, an ear cropped dog on. I called it out. They promptly got rid of that picture and went and put on this one of a brachycephalic. So I had to get in touch with them over again. Got another one, a bit embarrassing, a vegan company here, vegan magazine. This morning was particularly bad recently, laughing away at flat-faced rabbits and referring to French bulldogs with obvious deformities as cute. And so it goes on. This was just last Saturday. I tuned in, had a coffee, tuned into the television, and Beechgrove Garden was featuring this little pug. And within 10 minutes, James Martin on Saturday Kitchen was describing a French bulldog as cute. Don't buy brachycephalic pets, get the demand driven down. Loads of these about, all sorts of different greeting cards. Don't buy the cards and write to or contact the company that make them and complain about it. And other merchandise. If you want a t-shirt, get one from One Kind. They've got a great range. And of course, we can support One Kind. And Kirsty mentioned the manifestos, great manifesto covering all sorts of aspects of animal welfare, and in particular, calling for public education and discouraging the breeding of animals with exaggerated features. And I hope I've persuaded you that it's not cute to suffer the life of a flat-faced pet. So thank you for listening. I'd like to thank Emma Milne particularly, who provided a lot of the photographs. Many of the others were stock photographs from copyright-free websites. Emma Milne allowed me access to her collection, and I hope I've correctly credited all the photographers there. Also like to thank Pdsa for allowing me access to the PAW report. A general thank you to all the researchers who are doing the work and building the evidence base that we need. And thank you to One Kind for letting me talk about one of the things I'm passionate about for 3/4 of an hour. If you do have any further questions, then if I can't answer them just now, you can contact me at that email address or on Twitter at KillManyBirder. Thank you very much.